We're back with some more cognitive behavioral therapy. We look like we've got a couple of really short chapters back to back. The link between anxiety and depression and social media anxiety and depression. So first, 7.1, the link between anxiety and depression. Anxiety and depression occur together, but how exactly? After all, they are two different conditions. Anxiety is a state of high energy, while depression is a state of low energy. Yet both have more similarities than you may know. A person with a depressive disorder is likely to experience anxiety and even panic attacks. In the same breath, someone with anxiety is likely to experience depression. In itself, it can be really depressing to experience anxiety attacks. As humans, anything at all that makes us lose control over our lives or actions can be depressing. Anxiety disorders and depressive disorders share similar components and causes, but they are different. Being in a state of depression facilitates feelings of despair, hopelessness, and anger. Usually, the energy state is very low, and people with depressive disorders feel consumed by daily activities and the personal relationships in their lives. On the contrary, anxiety makes a person experience fear and panic in situations where they ordinarily shouldn't feel threatened or fearful. Someone suffering from anxiety may have panic attacks, even without a trigger. Both anxiety and depression can affect your ability to function normally. If you suffer from anxiety, chances are you will also experience depression at some point. Statistics have shown that a higher percentage of people diagnosed with depression also end up being diagnosed with an anxiety disorder. How does depression lead to anxiety and vice versa? When you suffer a bout of depression and you start to lose interest in the activities that once made you feel alive, you begin to miss work, spend most of your time sleeping, and basically missing out on life. This affects your personal and professional relationships, and the feeling of depression becomes even more overwhelming. Let's say the depression starts to wane and you begin to feel like you can have your life back. Suddenly, anxiety comes knocking. Why? Because you realize how much you have missed out on, and you are afraid you may not be able to get everything you have lost back. You may ask yourself, how do I go about my life now? Or what will I do about everything I have lost, my work, relationship, and money? In this case, depression leads to anxiety, and this anxiety sends you into another bout of depression. The relationship between anxiety and depression is a one-way street. Simply having an anxiety disorder, especially a panic disorder, is the factor most likely to cause you to develop depression. That relationship between anxiety and depression shares a biological precedent. The persistent state of high energy in anxiety and the continual low mood experienced in depression both have to do with an imbalance in the brain's chemical function. It is believed that low serotonin levels contribute a lot to the development of both anxiety and depression symptoms. Just as other neurotransmitters like epinephrine, dopamine, and norepinephrine also play a role. While the biological basis of both conditions is similar, you experience anxiety and depression on different levels of consciousness. Therefore, we can say that anxiety and depression are two sides of the same coin. As I have already said, anxiety and depression sometimes occur concurrently or sequentially. That is, one happens in reaction to the other. Or they can both occur together. When anxiety and depression occur sequentially in clinical diagnoses, it is referred to as comorbid condition. The symptoms of both conditions are usually more severe when they co-occur in an individual. The more severe the symptoms are, the faster you are advised to go for psychotherapy and possibly combine it with medication. 7.2. Social media anxiety and depression. It is no news that many people agree that social media has a significant negative impact on mental health, but according to a new study, this may be a false notion. It would be incomplete to talk about CBT as an alternative therapy and conditions like anxiety and depression and addiction, which CBT can be used to treat without giving a mention to social media. Social media is acknowledged by many people to have tons of negative effects on mental health, for good reason. It is important to note that therapy can be ineffective if other factors, like social media, continue to contribute to your symptoms. In therapy, your therapist may work together with you to understand how your use of social media is influencing your anxiety and depression. But it is not social media in itself that contributes to symptoms of anxiety and depression. Rather, it is the activities that happen on social media and the way you interpret them. People who make moderate use of social media rarely have their mental health affected. However, the addiction to social media causes a lot of people to lose sleep, which can cause stress. This in turn causes anxiety, and then anxiety causes depression, and it goes on and on like that in a cycle. Social media also affects self-esteem a lot, and as you know, poor self-esteem is linked to both anxiety and depression. Everyone has their fair share of insecurities, which they either keep to themselves or tell others in confidence. However, social media provides an avenue to compare yourself with others, especially with the near-perfect Instagram photos and wholesome relationships, which can really attack your insecurities. For instance, if you already have insecurities about your body, and you see the perfect picture of an Instagram model, with a body you covet for yourself, you may start to compare yourself with this picture and then start doubting yourself. This attacks your already fragile self-esteem and leads to the possible development of depression symptoms, which in turn result in anxiety. To make your therapy effective, you must learn to minimize your use of social media and avoid all the toxicity that goes around on there. Bullying, body shaming, weight shaming, and class shaming are just some of the toxic behaviors that happen on social media. Try not to lose sleep over social media. Spend only quality time on social media, and make sure you spend your time addressing the positives instead. That was a short end to the chapter. We're looking at chapter 8 next, which is also pretty short, so we might just pump through that. CBT and addiction. Addiction is a dependence on the use of a chemical drug or activity or substance, not minding that it is causing psychological and physiological harm, and the inability to quit this dependence. Addiction is one of the mental health conditions that can be effectively treated using cognitive behavioral techniques. When talking about addiction, it is vital to note that it doesn't just refer to dependence on a particular substance. An individual who cannot stop using a particular substance simply has substance dependence, not addiction. Addiction refers to the inability to stop any particular activity. Therefore, addiction can also be behavioral. CBT is most effective for an addiction when it is behavioral. When you become addicted to a particular substance or activity, you lose control over how you use or partake in the activity and become completely dependent on it for survival. Normally, it may seem like addiction isn't directly caused by negative thoughts. So, why would CBT be effective for addiction? Well, addiction is a behavioral problem, and it does sometimes originate from negative thinking. Sometimes anxiety and depression are the cause of addiction if a person is irrationally anxious. They may resort to the use of a particular substance to deal with the feelings of anxiety. They can also resort to engaging in certain activities to manage the anxiety. Such activities may include eating or sexual activities. Therefore, negative thinking can inadvertently result in addiction. In fact, there is a major correlation between anxiety, depression, and addiction. Addiction is a chronic and complex disease, which affects normal functioning. It can seriously damage your relationships, career, and life as a whole. However, with effective CBT techniques, you can prevent, treat, and manage anxiety. Cognitive behavioral therapy helps you understand how to confront and deal with the problems in your life, which are driving your addictive behaviors. You already know that the way you think and feel is what impacts your behaviors. So the focus of CBT for addiction will be to replace the self-defeating thoughts fueling substance abuse or addiction. The role of CBT in the treatment of addiction. A mind hit by addiction creates an unhealthy environment for change, thoughts, and questionable emotions. A mind hit by addiction creates an unhealthy environment for negative thoughts and questionable emotions to develop. It also creates a compulsion for substance use and activity addiction. Together, this shapes the way you relate to your experiences and changes how you perceive substance abuse. If there is already a pre-existing mental condition like anxiety or depression, that imbalance fuels substance abuse. Managing the thoughts and emotions that come with life's challenges can be quite difficult. Coupled with addiction, it can be quite devastating. Without help from a licensed professional, you may find it difficult to manage your thoughts, emotions, and behaviors in a productive and positive way. The negative thoughts and feelings that result from the challenging experiences can further serve as a trigger for addictive behaviors. Going to therapy helps break the cycle and serves as the foundation for treatment and recovery. One of the reasons CBT is such an effective treatment for addiction is that it uses an intensive and present-oriented approach, which makes treatment much faster. The length of your therapy and the frequency of sessions will depend on your addictive behaviors, individual needs, and your objectives for coming to therapy. Your therapist will create an addiction treatment plan after considering a number of factors, which include the addictive behavior and the circumstances of the addiction, the severity of your addiction symptoms, how long you have been dealing with the addictive behavior, the degrees of stress being suffered because of the addiction, how supportive your family, friends, and loved ones are. Considering all these factors will help your psychotherapist determine an appropriate treatment plan for your condition. As you continue treatment, the plan may be modified to suit your recovery goals and current circumstances. The goal of CBT for addiction will be to help you identify the context of your addiction, give you awareness of your negative thinking patterns, emotions, and behaviors, all of which play a role in the addiction, help you identify the negative beliefs that aggravate addictive behaviors, evaluate the reason behind the negative thoughts, and determine how to change them completely. Evaluate the reason behind the negative thoughts and how to... I just said that. Cognitive behavioral therapy is especially successful when used with other psychotherapies. It is supported by a variety of traditional therapies, especially in rehab. Dialectical behavior therapy is a specialized, evidence-based form of cognitive behavioral therapy, which blends CBT techniques with other approaches to treat anxiety. It involves the acquisition of mindfulness, distress tolerance, and acceptance skills. So we're going to call it there. We're coming in next chapter, chapter 9, how cognitive behavioral therapy works. So just having a quick flick through. Chapter 9, 10, 11. Probably 3 chapters left. 11's broken up into 2 parts, so we'll see how we go there. But thank you all for watching. Hit that subscribe button and I'll see you next time.